Robotic cardiac surgery is transforming recovery times and outcomes. But Dr. Gaurav Kumar of Apollo Hospitals in India says patients need to understand both its benefits and its limitations.
We can't offer robotic surgery to every cardiac surgery patient. So there's a certain subset of patients who are fit for robotic surgery, and that selection we do based on the various criteria which have been laid out over a period of time. And we have been, with our selection, we have been successful in more than 95% of cases to complete that robotic procedure and get them back on road very fast.
He explained some of the criteria used in selecting patients for robotic surgery.
So it's applicable only to a certain subset of coronary artery disease, single valve replacements, patients with normal left ventricular function, or adult patient with a hole in heart. We can't do it in pediatric population because their body size is so small and chest cavity is so small that we can't do a robotic surgery inside. So these are the general criteria. There are much more advanced criteria as to what's the condition of the kidneys, how the lungs are, how fit the patient is, what's the obesity status, what's the size of the patient.
And another one of Apollo's cardiac surgeons, Dr. Varun Bansal, explains that robotic surgery is one of the most advanced procedures offered, with no need to open the entire chest for heart surgeries.
These days, with robotic technology, what we can do is we can go inside the heart without cutting open the chest. We make two small holes on the side of the chest, put the camera in. The camera magnifies the inside vision by 10 times. And then around 8 millimeters diameter instruments are put in, and we can do all sorts of procedures.
This, he says, leads to a much quicker recovery for patients, recovering out of ICU within 2 days, home within 4 days, and back to their active lives within a week.
One, this reduces the trauma to the body. Second, because there's no bone cutting, there's less bleeding. The patient has less pain. The chances of complications are less. As we can see better, the vision is magnified, so the precision increases. All this adds up to the better outcomes that the patient has.
For the past 5 years, Apollo has partnered with Trinidad and Tobago to treat mostly complex pediatric cardiac cases, along with a few liver and bone marrow transplant cases that were too risky to be handled locally, but those weren't robotic surgeries.
We have been mostly treating cardiac surgical patients through Children's Life Fund Authority. Dr. Amroop will elaborate more on that. And what we have been getting is basically the complex, the highly complex, multiple times operated patients who cannot be safely done here and who require a large infrastructure and intensive care for them to be made well.
And local pediatric cardiologist Dr. Ronand Ramroop, based at the Eric Williams Medical Sciences Complex, says in his field, between 30 and 40 patients are referred for foreign care through the Children's Life Fund. And he believes there is a need for expansion of the fund.
So things that are, as I said, beyond a certain complexity need to go abroad. With the joining of Apollo to the team of referring centers, we've been able to send more and more cases of more complexity, meaning that before the complex cases would be denied care because it would exorbitantly pricey or the centers themselves didn't want to take on that risk. And Apollo has been very good about taking on our high-risk cases and giving those kids a chance.
Apollo says its mission also includes training local healthcare professionals, building long-term capacity in the Caribbean. I am Sunil Lalla, and this was your TTT News Health Check.